Hi, I'm Mara Taraski, and I'm here today to talk to you about how Life Solutions can play a key part in fighting the opioid epidemic. Opioid addiction and deaths have created societal costs that have now in the United States accumulated to trillions of dollars. To date, this country is facing the worst accounts of opioid addiction in history. Per the National Institute of Drug Abuse, the number of drug overdoses, specifically involving prescription drugs, was 14,139. Between 2016 and 2017, the death toll for those years was around 20,000 deaths per year, solely on actively prescribed opioids. Several systemic reviews and research have shown that a palpable cause to the drop in prescribed opioid deaths in 2019 is due to synthetic opioid use. Synthetic opioids, primarily fentanyl, has been the cause of over 30,000 deaths in just 2019. Specifically, when opioids are prescribed chronically for pain management, it increases the risk of crossover to synthetic drugs, which unfortunately has a high chance of overdose as a result. Chronic pain with no comorbidity as sole diagnosis is the most common and costly medical condition. Hospital CEOs and other decision makers must analyze the cost benefit of prescribing opioids for pain management to those with chronic pain. Per a report in 2019, Pennsylvania taxpayers spent $178 million in opioid-related hospital stays. A report from Pennsylvania State Department reports an estimate of 39,468 people with a drug use disorder in Allegheny County and over 600 deaths in 2020. As a no-cost assistive program company, Life Solutions is highly affected by the opioid distribution and use of the drugs to treat chronic pain. In order to stay up to date on the current state of the opioid crisis in Allegheny County, Life Solutions must be part of the conversation. Historically, employee assistance programs have been a way to train people in personal matters, mental health, drug abuse, to re-assimilate into the workforce. Life Solutions, among other EAPs, cover a wide array of issues like child and elder care, so funds are widespread to other areas of need. If hospitals, pharmaceutical companies, assisted aid programs, and local and federal governments want to curb the excessive costs that accumulate because of the opioid crisis, organizations must create amendments and updated protocols to deal with opioid disease. Increased patients, increased prescriptions given, increased medical needs due to drug use, and opioid-related deaths stretch healthcare workers and resources thin. In 2021, in Allegheny County, the health department reported $2 million in grants to combat and prevent overdoses. The money was split 5 ways to combat various segments of the epidemic. Using various approaches, appropriately funded projects will directly link people with opioid use disorder to evidence-based treatment and recovery supports. The country has been battling the opioid crisis in various ways. Several scientists are keen to search for drugs and alternatives to the powerful opioids, including hydrocodone, oxycodone, morphine, that will lessen unwanted side effects that cause addiction and sometimes death. There are ways Life Solutions can allocate funds where it is cost effective to the company while also benefiting the essence of the company, the clients. The program should advocate for the use certified recovery specialists to be a liaison in emergency hospital and inpatient settings to reach clients. Certified Recovery Support Specialist, or CRSS, is a position that one can become by obtaining a certification who can use their life experiences to help others in treatment and recovery. Recovery specialists are able to share a unique perspective to those who have similar life experiences. Life Solutions benefit to hiring CRSSs will curate more clients to go through the specific company for rehabilitation. By outreaching to hospitals, outpatients, and inpatient rehabs, homes, and other facilities that accommodate to those with drug abuse disorders, CRS specialists can make connections only other persons in recovery can make. An advocate for the Life Solutions Company. Life Solutions may also find it beneficial to employ and invest in recovering addicts and fund their certification to become a CRS. Life Solutions has a national and international footprint, including a network of 12,000 EAP and behavioral health professionals across their overreaching countries, which is the United States, Canada, and Mexico. By implementing and following a strength-based approach to address the unique needs of returning citizens who have substance abuse disorder, will create less relapse and repeated needs by the company. The goal is to rehabilitate. The goal is to also keep the company running smoothly and using resources and funds appropriately so the program is at its highest function. By using strength-based community intervention approaches, funds will use to create a coordinated care plan for persons that will link returning residents to receive support and treatment through case management and mentoring, such as using a CRSS. Life Solutions is a nonprofit that receives incentives from government aid that will allocate more funds if the nonprofit applies these incentives into the program. Allegheny Health Network's health plan offers incentives for companies to use generic drugs when available. Generic drugs offer lower copays for users without sacrificing care or quality. Generic drugs are cost-effective alternatives that will cost less for company and user. Those with chronic pain exert immense burden on societies, cultures, and people. Recent guidelines by the CDC have recommended that the use of opioids for non-malignant chronic pain should be used in rare circumstances. Medical professionals who treat chronic pain patients are beginning to approach a comprehensive and multidisciplinary team of treatments, which may include pharmacotherapy, but it should not be the first course of treatment. Many doctors provide non-opioid pain medications to treat chronic pain, but for some that may be the only feasible option. In this case, one of the many supports that Life Solutions should employ should create a safety net for opioid users of chronic pain that will create an environment that will be less likely to create a drug abuse disorder. There are different drug classes that have been researched and tested for different types of chronic pain conditions, and results have been positive that certain classes are positive in managing chronic pain. Life Solutions should consider employing outreach and education to patients and physicians that these drugs have had less reports of addiction. There are many chronic pain diseases that have been tested with varying drugs. Persons diagnosed with myofascial pain syndrome have had positive results with NSAIDs, muscle relaxants, topical Lidocaine patches, and Botox. Fibromyalgia has been well documented in reporting ARIs, membrane stabilizers, muscle relaxants, NMDA antagonists, and cannabinoids. Neuropathic pain conditions have significant positive findings in pain reduction with membrane stabilizers, ARIs, Lidocaine patches, and Botox. There are explanations and challenges in this overhaul and making a new way of how we handle drug abuse disorders. Pain research is underfunded in private and public healthcare centers. Efforts are ongoing to try to improve federal funding for pain research, but nonprofits like Life Solutions have to be a part of the conversation. Despite chronic pain being the most prevalent public health condition in the United States, the severity of the problem is not recognized by general societies. A cultural and attitude shift around chronic pain and research, as well as refocusing and refinement of research, improved research education, and government investments are imperative changes to the system and conversation about chronic pain and management. More investments and interest by our nonprofit EAPs is needed to determine the most effective ways to treat pain management and in turn treat the opioid epidemic. Most research of combinations of pharmacotherapeutics are needed to determine whether incremental or synergistic benefits are seen. It is important when doing research to maintain the same methodology where the same outcome measures can be validated. Thank you for your time, and I hope you consider Life Solutions to help combat the opioid epidemic. Thank you.